Well, they are words no person ever wants to hear, that you or someone you love has cancer. While a cancer diagnosis can be overwhelming, patients at Trinity Health receive expert care from a dedicated team using some of the most advanced technology available right here in West Michigan. Today, we're joined by Dr. Lindsay Robel. She's a neuro-oncologist from Trinity Health, talking about treatment options for brain tumors and cancers that affect the nervous system. Thanks so much for being here.
Thanks for having me.
Absolutely. Let's talk about, something that no one really wants to talk about, brain tumors. Let's talk about what kind of tumors that you're treating at Trinity.
Sure. So, as a neuro-oncologist, my expertise is really in taking care of patients who have brain tumors, whether that be the most common type of brain tumor, a meningioma, or the most aggressive glioblastoma. I also help take care of patients who have cancer that is spread to the brain, whether that be symptoms they have, seizures, or swelling that's causing weakness, radiation that's caused swelling, those sorts of things as well.
Okay, so let's talk about how the treatment at Trinity is different for patients. What kind of options you offer?
So I think one of the things that's really unique is our team, from the neuroradiologist who recognizes a tumor on the scan to the neurosurgeon who removes the tumor. We have a wonderful team of radiation oncologists who help treat the patients. I think a unique player that we don't have elsewhere in West Michigan is our neuropalliative care specialist. Okay. So someone who is specialized in treating the neurologic symptoms for patients, which is a really a unique area of expertise. Okay. And then obviously neuro-oncology, which is a rarity in itself in the state.
Yeah, and you talk about all of these different players. I mean, it really has to be a team approach when you're talking about something like a brain tumor. Let's talk about how that, and really the navigation of a patient's journey, cancer journey, how that's different at Trinity.
Yeah, absolutely. So some of it comes down to obviously identifying a tumor, having the tumor removed. We have really wonderful nurse navigation, so a navigator who will stay on board for a patient's care, help make sure that their appointments are all lined up, that their scans are lined up appropriately, they get their labs, they get their chemo. There's a lot that goes into it, and I think initially when patients sit down, it can be really overwhelming, especially if they're coming alone or if they have a new caregiver who's not used to managing all of these details. Sure. And even for people who are organized, it can be really overwhelming. Yeah. So that part's really nice that we have nurse navigation who help guide patients through kind of the detail-oriented piece of the puzzle. The other thing we have is obviously our tumor board. So sure. A multidisciplinary tumor board is really crucial for patients with brain tumors. These are rare cancers, so sure. Having specialists who are attuned to the complex care that needs to go into decision-making for these patients is really important. So okay. We also have, through the Cancer Network of West Michigan, access to our team at Michigan Medicine, which is also really important for making sure that we're not missing things or that we're considering all options, making sure we know about the latest clinical trials that are available either in Grand Rapids or outside of Grand Rapids for these patients with rare cancers.
Wow. I mean, so many players, and obviously you have such a top-tier team. Technology, though, also plays a crucial role, and it changes so drastically, so quickly. Let's talk about the technology that's at your fingertips.
Yeah, it's really important. So I think as things have advanced, whether it's from the laboratory in terms of the molecular testing or understanding the genetics of the tumor, how that weighs into targeted treatments, or telling us even just about the behavior of a tumor, what to expect, how aggressively to treat or not treat. That is something that is really important. Our pathology group is really kind of the leaders in terms of what we test and where we send things and that sort of thing. In terms of radiation therapy, using more targeted techniques specifically for patients who have metastatic cancer or cancer that is spread to the brain sure. is really important to help try and minimize side effects from that treatment, as well as doing things like awake craniotomies or using a specific type of tool to kind of highlight the tumor in the operating room so the surgeon knows exactly where to remove. That part is really important, again, for providing the best care for our patients.
Absolutely. And then let's talk about the neurotoxicity clinic. I don't really know what this is, but this is something that's a big deal, and it's not just for cancer patients.
It is just for cancer patients. So the toxicity clinic is really looking at neurologic complications of cancer. Okay. So there are kind of specific parts of the role. I take care of patients who have primary brain cancer, so things like glioblastoma, oligodendrogliomas, those types of things, but also taking care of patients who have other types of cancer. So let's say breast cancer, receiving a specific chemotherapy that causes brain fog or causes neuropathy. If a patient has painful pins and needles in their feet, seeing a neuro-oncologist to help manage medication to target that neuropathic pain, talking to them about expectations when they receive chemo. Is this going to last for a long time? Is this going to improve? And also putting patients in the right hands in terms of physical therapy, occupational therapy, speech. Do they need a physical medicine and rehabilitation specialist to really kind of guide their rehab, as well as managing seizures? There are many patients who have brain metastases that do develop seizures, and so being able to see them and kind of guide, how much do they need steroid for some swelling related to the tumor or related to their radiation treatment or other treatments. What type of seizure medication would play well with their chemo, those sorts of things. So this is something that we're excited to open and offer at both sites, so the University of Michigan Health West and Trinity Cancer Centers, for any patient with cancer who develops some sort of neurologic complication.
Okay, perfect. All right, so Lindsay, tell me a little bit about the Cancer Network, what that is.
Yeah, so the Cancer Network of West Michigan is this really cool collaboration between the Trinity Health Hospitals, so both Muskegon and Grand Rapids, as well as the University of Michigan Health West in Wyoming and Michigan Medicine in Ann Arbor. So what this collaboration is really meant to do is help provide specialized cancer care to West Michigan. We want to be able to provide, the care that you would expect in Ann Arbor or at Henry Ford here in West Michigan for patients.
Wow, everybody working together for a common good, right?
Absolutely.
Get people healthy. Well, thank you so much for your time. We really, really appreciate it. Of course, you want to learn more, there is that on your screen, trinityhealthmichigan.org for all your questions.